Wow. So we're starting now. Good afternoon, everyone. Good afternoon. Yeah, we're just actually waiting for others to join in and to settle down as well. And we are actually, trying to check our internet connection, making sure the host is, having the right, things in place, the logistic. Yeah. So we would commence, without wasting too many time. And because we have limited time as well. So for those who do not know me, my name is Sharon Akboguma. So myself and Norma will be. Oh, sorry, I put my camera on. Sorry, I didn't realize. Is my camera on?
Yeah, it's
Yeah.
on.
Right, so it's showing as if it's not on. Anyway, for those who do not know me, my name is Sharon Akboguma, and myself and Norma Dada, Mrs. Norma Dada, will be presenting today's workshop. And just before starting, the agenda for the day, like I've earlier mentioned, is going to be 2 hours, 30 minutes. So within the next 5 minutes, we'll just, before starting, I will just give a little bit of a housekeeping. Could everyone try to mute, their audio just to prevent noise from the background? So myself and Norma will unmute ourselves at specific timing to allow us to actually talk. And just before, starting as well, it's also important to let you know that if you got any question, could you add it on the chat, why the conversation is going on or the discussion is going on. And if you want, any information, um, other, further information in regards to what we're doing and to be contacted for future events and courses. So I would suggest you leave your name, with the host. I'll share my details after, my telephone number and email address. We would contact you, for future events and conferences and coaching courses that we do. So that's the housekeeping for today. And just make yourself comfortable. If you're able, grab a cup of tea or coffee, water, whatever you feel will make you, comfortable. Get a comfortable chair as well. So we would run, we'll carry on. We'll take a break at some point. I think about 1 o'clock we would take a break, a coffee break for about 10 minutes. Then we'll carry on, to conclude the remaining of the session. So like I've earlier mentioned, I believe I've introduced myself and I've introduced Norma. And today's a workshop, is a central around the type 2, the awareness of type 2 diabetes. And this workshop presentation will give an insight into, knowledge around the prevention, reducing blood sugar or blood glucose, as some of us know. And for those who do not understand, that's sugar in your blood, and management of diabetes and the risks associated with diabetes. So I believe that since we've all turned up today and we already have about 14 people, already joining us today, like me and you probably, I believe that we're all searching for information and knowledge, that could make a difference in our life, in the life of our family members. And then my prayer today is that you find it here, as we engage. So I know that some of us do not have diabetes and some of us do. And I believe some of us have friends and families that have, diabetes. We all have one common thing and a goal. Today we are all learning, and our purpose here is to get knowledge. So I believe as you're sitting down right now to hear the information that you get from this platform. So I believe you will get an idea or something that you will take away today that will make a difference in your life and perhaps even to, improve your health and other issues. So I hope, with my heart, that wherever you are, that you will find, something to take away with you today. Yeah, so I'm glad for the opportunity. We are glad for the opportunity to be able to speak to you. And then for the past few years, I have experience in nursing as a registered nurse. I have 9 years as a registered nurse practicing, and then Norma have 21 years practicing as a registered nurse and also a diabetic specialist. So I hope some of our experiences today and our knowledge around the issue of diabetes, would be helpful to you. And I hope you hear something today, and I hope it brings blessing to your life. So briefly, I will talk a little bit about what we are doing. and what diabetic awareness is all about. This session or this Zoom meeting is about. Our meeting usually is very holistic in nature. As I will say it, we meet the needs of a person, both the physical need, the mental need, emotional and the spiritual need of a person. So firstly, why are we offering these services? We doing it based on our nursing knowledge, you know, based on the nursing diagnosis and personal experience. And so, like I've earlier shared, we are experienced in terms of health practitioners. So, secondly, myself and Norma, we both lead a Gate of Precious Stone ministry. It is a Christian-based ministry. So we engage in community outreaches and event workshop and conferences in our community. So when we engage in conferences, it's not that we are religious group. We believe so much in Christ's virtues. So within our conferences, we make a difference in the life of people we connect with. So our purpose and our vision is based on Christ's virtues. Like I always share with people, we are Christ followers because the scriptures teaches us, that Christ went about in the community doing good. He was engaging with different people from different personality, from different backgrounds, and reason we're doing what we are doing because of the love of Christ in us. And so we're meeting the needs of people just as Christ did. And so I believe today that our presentation, just like every of our meeting, will be guiding people, into knowing the truth around diabetes, into having the knowledge about diabetes, because we believe, that when you know the truth will set you free. And we believe bringing the message of hope in terms of diabetes will be like an anchor, because when you have hope in life, it's like an anchor that holds you in place when you're facing crisis. And then every knowledge and every information that we bring in today would, bring you to that place where your anxiety and your worrying around diabetes, would be minimized. And I hope as well that the knowledge that you get today will bring the prevention of diabetes. It will also help with the reduction. It will also help with the management of it for those who are already, having issues, with diabetes. So my encouragement today that there is hope in diabetes. It's not a death sentence, and the knowledge you gain today would actually help, with managing the complications. Yes, sorry for the noise behind. So it will help with managing the complications that comes with it. Yes, so just to carry on with today's session. Today's session is actually evidence-based. Every information that we are bringing across, other than, our personal experience, other than our knowledge as medical practitioners, it's also evidence-based. And just to carry on as well, without wasting many most of your time in it, I came to this realization that sometimes you cannot change your history, you cannot change your genetic, but you can change your lifestyle. And reason I'm bringing this knowledge to you, in changing your lifestyle, then you will help to prevent, the development of type 2 diabetes. And in the long run, changing your lifestyle, having this knowledge will also help you to reduce your blood glucose level. So this is where my story, started from. My story started when I became aware of the, prevalence of type 2 diabetes among the Black and Asian minority ethnicity. That stage 2 of type 2 diabetes usually starts from the age of 40, sometimes from the age of 45 and above, especially with weight gain. But, I wasn't expecting this to happen to me so soon because of my natural, built body and a healthy appearance of a woman of my age. So just shortly after I hit 40, when I hit 40, I took it upon myself. It's not that I was showing any symptoms in my health. No, I just felt, okay, it was necessary, based on my knowledge on healthcare, my background. So I decided to go for a full blood screening, like test, as some people would know it. So within a couple of days, after having my blood done, I received a call from my GP, my doctor, to review my blood test that was taken. And when I after having a meeting, when I got there, I received this shocking news that my blood glucose was actually high, above the normal range, which is from the medical terms, for those who do not know, is like it will check the sugar level in your blood. It's called the HbA1c level was 69 minimum, which was actually above, the normal range, and it actually confirmed pre-diabetes or type 2 diabetes. It was a rich shock to me. I felt really devastated as a result of it. So my GP, my doctor, actually suggested I started taking some oral anti-diabetic medication as a first line of treatment. So I was very I'm very much aware of changing lifestyle modification. So I negotiated with my GP for a lifestyle change, such as maintaining my diet, exercise, management. So I did negotiate and ask whether I could do this for 6 months and have a repeated blood test at the end of 6 months. And if nothing changes, then I can commence on taking my medication as she suggested. So, several years before now, before this diagnosis, I never used to take notice about my diet. Although I'm aware of the consequence of diet and exercise, but I didn't really pay much attention to it. So I remember growing up in a large household, we are used to cooking, large amount of food like complex diabetes, complex
Not
carb,
at all.
you know, and growing up in such household, also we cook often, big diet, eating a large portion, and then not really taking much attention about it. So sometimes my sister Norma would usually come around and update us and give some suggestion about, maintaining diet, healthy diet, but I didn't pay attention, like I said. But I was aware that, diabetes history is in the family. So I just went on expecting that. So, like I said, after this routine, it was a shock for me. I felt it was like an emotional collusion, I felt emotionally distraughted about it. Although I wasn't showing symptoms, but I felt good. I went for a screening. Good. First step, and that's very, very important for every one of us. I would recommend that to go for screening, at least when it's been discovered early, there is, opportunity to rectify issues within your health. So, like I said, I felt like emotionally distraughted about it, but I had the opportunity to discuss with my sister once again, went back to get some support and advice. So we decided to set up a goals, we set up a goals, and the reason for setting up that goals was to be able to achieve some certain aim. The aim was to reduce, my blood glucose, and this was my motivation. My motivation was to, my aim was to reduce my blood glucose, and my sister and myself were able to set up a plan that would, help us, to achieve this particular goal. And I also believe that getting knowledge around it was very, very important. So since I received, this diagnosis from my GP, so I became very active. I took it upon myself. I'm sharing my story, just as a way of motivating everyone listening today. So what actually helped me most was, I started to become very active, getting knowledge to improve my health. And I started reading a lot around, diabetes and the significant factors, maintaining optimal, blood sugar level. And I was determined about it. I was aiming at a well-balanced diet as well. And at the same time, I was aiming to be able to meet up to my BMI, within the recommended target. So, and as a result of that, I noticed, improvement in my blood glucose. And as I began to notice the improvement in it, and I knew that it was also important for me to begin to share this knowledge with others, with family members, and with, my Black community, the Black Asian community, because I know, because if you have this history in your family, there's that tendency of you developing it. And also the scripture that actually came to my mind then while I was reading around diabetes, while I was changing my lifestyle. Could somebody, mute? Yeah. Please put, mm, yeah, mute your audio, please. Yeah, sorry about that. Yeah, so like I was gaining a lot of knowledge, and the scripture that actually came to my mind was that my people perish, for lack of knowledge. When you don't have knowledge in issues around, um, health conditions like diabetes, like this, it could lead to some complications, But like I said, gaining this knowledge was very, very effective for me to be able to manage this condition. So I can confidently say that since my diagnosis, maintaining healthy lifestyle, and following, the description that was given to me, from my sister, the goals that we've set, I've been able, to achieve the aim of reducing my blood glucose. And then when I went for repeated tests, like I said, after 6 months, my blood glucose actually reduced down to about 49 millimole, which was a great difference without medication. I'm not suggesting that you shouldn't take medication, but what I'm just saying that initially I took it upon myself to negotiate with my GP why I had this time, why I had the opportunity, why I still have control over my health, to be able to make a decision. So it actually worked well. So my goal today is that whatever you've heard from this session today, that you take something, away that will make a difference, to your lifestyle and to improve your health. And I believe that's our aim today. So without wasting much time, I would call Norma, to introduce us into the next session. And then, like I've earlier mentioned, if you have any questions along the way, try to, I'll post it on the chat, and then we will get back to you with the answer at the end of this session. We will have opportunity for plenty of questions and answer time. So I welcome Norma Dada, to take on the second session.
Thank you. Thank you very much, Sister Sharon. Thank you. Good morning, everyone. Thank you so much for joining us from far and wide. I think we've got few people from the UK and outside of the shores of the UK. So thank you for joining us. As we know, Saturdays are busy for everybody, and I'm sure you could be doing a million and one things, making more money or being more healthy or resting more, but you've decided to come and join us today. So thank you for coming. And as the host has mentioned already, our goal is to increase knowledge out there. Our goal is to make sure that the information is out there, and you can hear from her story. A lot of the time you get that diagnosis, so you're thinking, what next? Is this a life sentence? Is this a death sentence rather? So is this a death sentence? Where do we go from here? And I love the fact that without, just taking that time out, setting those goals, putting those action plans in there, she was able to actually change that high HbA1c down to 49, which is pretty much on the borders of going down to 47. And when we talk a little bit more in the day, we will look at what the normal levels are and some of the things that we can obviously do to prevent diabetes. So without further ado, I'm going to share my screen, which it's not letting me do that. So if you can just make me the host or allow me to share. Yeah. We love Zoom when it works. Okay. Yeah.
You can share now. Yeah.
Okay, perfect. Yes, I'll just do that very quickly. Can you see my screen? Okay, great. Yeah, so we did try this earlier today. Just make sure I've got the right one. Okay, perfect. Can you see that? Lovely, yes. Lovely. Okay, so as it's been mentioned today, I will need a timekeeper, so I can't quite, because once I go into this mode of presenting, I can't quite see my time. I think I can still see 12:27, so I'm really trying to be on time. And as it's been said, if you've got any questions in the course of the presentation, please pop into the chat, because I will be going as fast as I can, but I think I have a feeling there are things that people want to talk about that I may not cover. So if that's the case for you, please put in the chat. We've got 2 question and answer sessions in the course of the day. So if we don't cover in the first one, we'll hope to cover in the second one, but do let us know, because there's so much to talk about, and we've only got about 2 hours now, so, and we're trying to put a break in between, so we're gonna try and really condense things. But if you've got any questions, any comments, any myths to debunk, please pop into the chat, and the host will collate all the questions and we'll hope to answer the questions. So without further ado, we're going to start. Today is about raising awareness on diabetes. You know, a lot, I mean, we've had the sessions, you know, over, I think it probably started around sort of post-COVID, and that's really because we're finding that COVID did not help anybody. I mean, apart from obviously the death, which is very, very sad. Even from my professional background, a lot of people have said to me, you know what, Norma, we've seen a lot of diabetes diagnosis post-COVID. And we know what happened in COVID. We weren't going out. There's a lot of sedentary lifestyle. So it did not help for many people who were kind of on the cliff edge. COVID just kind of tilted people over. So today is to raise awareness on diabetes, but also what is special about today is that we're going to look at pre-diabetes. And that's something that we normally don't, we haven't quite looked at in the past. And that's because we are becoming aware that there is often no symptoms when you have pre-diabetes. You're kind of in that middle ground where you can either go over the edge or you can walk back. So I'm using the word edge because I'm trying to create, you know, sort of a visuals in your mind to think about diabetes like is a scale. Are you walking towards it or are you walking away from it? And today we want to give information on how to walk away from it if you don't have it, and if you do have it, how to better manage it. So I'm hoping that's my goal today, and I'm hoping that I'll be able to achieve that. So again, very quick overview of the workshop. We'll be looking at diabetes as a whole. So looking at the, you know, what is it? What is diabetes? What are the causes? What are the symptoms of diabetes? You know, and how can we manage it as well? So we look at prevention, we look at pre-diabetes, as I've mentioned, and also treatment. Okay. So my goal today is that at the end of this session that you have increased knowledge in you know, of diabetes, that you also have knowledge to make the right food choices to help prevent or better manage type 2 diabetes, and also to increase your confidence to build a healthy lifestyle. And I think, as the host has mentioned, healthy lifestyle is the key. It's not a fad diet. It's not something you do 6 months, you achieve your result, and then you take your foot off the burner. It's something that you develop as a habit that you need to develop to become a part of you. So I'm hoping that's what we would learn today as we crack on with the day. So again, this is one of my favorite verses when I talk about diabetes. My people perish for lack of knowledge. We know that understanding, having knowledge about something is the first step to change it, because if you're going to change, you need to know exactly what you're changing. Why are you changing it as well? So understanding diabetes does not only prevent it, but it also helps to better manage it. Okay. But what I'm finding that is beyond the knowledge. Knowledge is a start, is fantastic, but the transformation comes from the application of that knowledge. Now, today will be a lot of knowledge, you know, giving you knowledge. We might not get time to really look at the practical steps, which it's a big kettle of fish. And I think, as the host has said, we're looking to actually do more of this in a one-to-one coaching session as well, because a lot of the information we're going to give is going to apply to people in very different ways. So, but what I'm really trying to say here is having the knowledge it's great, but applying that knowledge is how you see the transformation in your life. So that's what we're hoping that today will kickstart for many of us. So what exactly is diabetes? Diabetes, please feel free to take your notes. We are recording, so we might have this available for people who would like to, you know, revisit this talk at another day. So diabetes is a complex metabolic disorder that affects how glucose is used in the body. Now, I did try to simplify this definition, but I can't take the word metabolic out of it, because diabetes indeed involves a lot of organs in the body. And, we know that at present, a lot of our lifestyle promotes what we call inflammation. Now, I won't talk a lot about inflammation, but diabetes, hypertension, heart disease, these are all inflammatory conditions. Again, I won't talk about inflammation in itself, but so diabetes basically affects how our body uses up glucose from the food that we consume. I've got some, statistics here just to kind of, give us insight into the scale of what we're dealing with. So we know that there are about 4.9 million diagnoses of diabetes in the UK, of type 2 diabetes. I have to say that, because when we talk about the types of diabetes, I'll just touch a little bit about other types, but we're talking predominantly about type 2 diabetes here. And that's because that is the form of diabetes that affects Black and ethnic minority groups the most. Now, I said Black and ethnic minority for the UK viewers. I know that those outside of the UK, so Blacks are not minority groups over there, but basically for Black people in general and Asians, diabetes is quite prevalent. Type 2 diabetes is prevalent. And we know that 13.1 million people are at risk. So basically, people with pre-diabetes, think of that cliff edge I talked about earlier. There are about 13.1 million people on that edge that could either tilt into diabetes or move away from diabetes. And we have 850,000 undiagnosed. So people who already have type 2 diabetes, but are not even aware of it. And so it's quite frightening if you think about it. And I think, as we mentioned, the earlier you know about it, not knowing something means that you just continue what you're doing, which obviously is taking you towards the wrong end rather than a much better outcome. So that's the statistics we have on diabetes. And worldwide, we know that it's becoming potentially a pandemic, potentially, because of our lifestyle. Even a lot of African countries, I know that people from Nigeria here, a lot of African countries are being, westernized in terms of the diet is changing, the lifestyle, even of, not really farming as much. So things are changing, and sadly, diabetes risk is increasing in these countries. So very quickly, the graph in front looks very confusing, but I'll very quickly break it down. So this is what happens without diabetes. You have food that contains carbohydrates. I'll talk a little bit about carbohydrates in the second session of today. So don't worry, we will look at what carbohydrates are. So when you eat carbohydrate, it's broken down, and then your body secretes a hormone called insulin, which all of us know what insulin, we've heard of the term insulin. And what insulin does, if you think about insulin as a key, and if you think about your cells in your body is where the glucose needs to be to be used up and to give you energy. So think of the cell as having a door that needs a key to open that door and open it up, right? Insulin acts as that key. It opens the door, takes the glucose out of your blood into the cell, boom, you get energy. Very simple. So your pancreas is producing insulin 24 hours a day, whether you're eating or not. But when you eat, it produces a burst of insulin. So that's the normal physiology of insulin and your glucose. Hopefully that makes sense. I'm trying to keep it very simple. Okay. So what happens in diabetes? In diabetes, your organs are no longer responding well to insulin. Now, it's looking quite complex because we think, well, isn't you just talk about pancreas, insulin? How does the others work? So with type 2 diabetes, very quickly, I'll go through the organs on my screen. Your liver starts to secrete glucose quite a lot that you don't need. So without diabetes, your liver only really secretes glucose when your sugar levels are low. Okay, maybe if you're fasting, so that's why you don't die if you fast for a day or two, because your liver kicks in and releases glucose into your system. Your brain needs glucose. And then your pancreas in diabetes, insulin secretion decreases and it produces glucagon. Glucagon is a form of glucose. So think about it. Your insulin is coming down, but glucose is rising. So obviously your sugars levels are going to go up. And then I'll go very quickly. Your brain in diabetes, it decreases satiety. So two people can eat the same food. One feels full, the other doesn't. You know what that's going to happen. The one who doesn't feel full is going to feel the need to eat more, leads to weight gain. Okay, so diabetes affects all the different organs in the body. Now, to make it quite simple, back to that key and door, you know.
All right.
Yeah, can we just mute ourselves? Thank you. So back to that analogy of key and the lock. In diabetes, that key is not quite opening that lock. So it's either the lock is rustic or there's just not enough key to open the door. And what would your body want to do? Your body will start to produce more keys to try to counter that effect. And that's what we call diabetes. Oh, sorry, I'm a bit distracted. Thank you.
Norma, I think if you're host, you can mute everyone.
Can you mute those? Tell them to mute themselves because I couldn't mute.
Okay, no worries.
I couldn't mute.
I will do that. I'll just mute everyone. Okay. Perfect. Okay, lovely. Thank you so much. Don't worry, we're used to this. Yeah, all muted. I think that's it. Okay, lovely. Yes, so what happens in diabetes is your body begins to produce more key to try and counter that resistance. That's what we call insulin resistance. So you may have heard the term insulin resistance. That's what happens when the insulin your body is producing, that key is not fitting the lock. So what happens? The door doesn't open, glucose in the blood rises, and that leads to high blood glucose. Hopefully that makes sense. Okay, so now when that happens, you start to feel the symptoms. Okay, let's see. Yeah, that's it. Perfect. So the symptoms you start feeling include tiredness. Because of time, I won't go into why you feel each of those symptoms, but tiredness, you feel very tired. You feel confusion, stomach pain, blurred vision, very common blurred vision. I tell you a very funny story. I had a patient once who said to me, you know what, Norma, I spent hundreds of pounds on buying glasses thinking that my vision was going. All that was happening was actually diabetes. My sugars were high, and the minute he got diagnosed, put on the relevant medications, the vision was restored. So when the sugars go high, the vessels behind the eyes are very sensitive to high blood glucose. When the glucose go up, it can cause the vessels behind the eyes to burst and leak, and that's what causes blurred vision. So very common. I'm mentioning the symptoms because for some people, you might feel the symptoms, others you don't. So very important to remember this. Now, you might feel a person whose glucose is high might feel very thirsty. That's because your body is trying so hard to bring that sugar down. And one way to do that is to flush it out of your system. So you may find that you're peeing a lot. So because you're urinating a lot, you want to drink more water. So these symptoms are very unique. For some people, actually, they start to lose weight. Now, when you start to lose weight, it's because you've bypassed these symptoms I've just mentioned. They're kind of like the first line defense of your body, telling you something is not right. When you start to lose weight, your body's starting to look for other source of energy. Because you're not having glucose, it starts to burn fat for energy. Hence, you see that weight loss. For some people, very dramatic, especially for those who have type 1 diabetes. So what are the causes of diabetes? We know that there's some things we can't change. And I think that's what the host mentioned earlier on. You can't change your ethnicity. Oh, have I stopped sharing? Okay, looks like I've stopped sharing. I'll let the host give
Hold on, yeah.
Yeah, no, don't worry. Just if you give me back the controller, I'll share it. Apologies
Just
for.
yeah, mute everyone. Yeah.
Okay. Yeah,
Yes.
cool. So I'm the host again, so I'll just share very quickly. Let's see. Okay, nice. Taking me back, but it's all right. We'll get there. Okay. Don't we just love technology when it works? Give me 2 seconds. We'll get there. Perfect. Okay. So can you see that? Lovely. So I'll pop this back down here. Okay. So yeah, so the causes of, okay, let's do this. Give me 2 seconds.
End it now.
Okay. Right. Okay. Right. Yeah, so the causes of diabetes, we know that genetics, ethnicity, age are things we don't have control over. Aging gracefully or ungracefully is something we don't have control over. Ethnicity, who we're born to, where we're born, we don't have control. Genetics, we don't have control. What we do have control, however, is lifestyle, which poor lifestyle and, you know, little to no physical activity, so it's what we call sedentary lifestyle, can cause diabetes because it leads to weight gain. Weight gain, we know, can reduce your sensitivity to the insulin that you produce. Hence, type 2 diabetes is predominantly caused by weight gain. Stress, smoking, alcohol. Now, again, time won't permit me to go into how stress causes diabetes, but it's a really interesting one. Stress is one of those really sneaky cause that we don't think much about. You know, we're busy, running around, running the household, running, you know, the kids, all of this stuff. And you sometimes don't look after yourself. You know, I had this conversation with a friend who's actually here today. I said, you know what, I've been feeling a bit down this week. And she said, you need to be healthy to look after the kids. I was like, yeah, that's so true. I need to remind myself. So stress is one of the biggest cause of diabetes as well. We know stress has been linked to cancer as well. Lots of people who actually got diagnosed with diabetes after a major life, you know, changing event. We know that stress can actually cause certain hormones, one of them being cortisol, which makes you resistant to insulin. So stress is a big one that, you know, we all need to learn how we manage stress. Very, very important. Now, why do we need to, you know, prevent diabetes? Why do we need to better manage diabetes? This is one of my least favorite slide, but it's what we need to talk about. Diabetes has been shown to cause heart attack, you know, blindness, foot amputation, kidney damage, you know, other heart disease. It is basically nasty. You know, it's something that we don't like to talk about, but it is real. Diabetes is a horrible master if we don't take control of it, if we don't prevent it, if we don't, you know, manage it. So there is a case for us to have a healthy lifestyle. Very quickly, I'll talk about the types of diabetes. So as I mentioned earlier on, we've got type 1, type 2 diabetes is the one we're talking about today, but there's also type 1 diabetes, and that's when the body's not producing any insulin at all. So this is often diagnosed in children, so young people, usually, I mean, I say this, but in my profession, we've seen type 1 diagnosed in 80-year-olds. So it's not really just, you know, but predominantly is in young people, juvenile, young adults. And then, you know, there's no insulin production. So for people like, so this event is not for the type 1s because you don't produce insulin, you need insulin. For people who have type 1 diabetes, we don't really talk about, obviously healthy eating is for everybody, but we don't really talk about carbohydrates and its role because it's not about the food. It's the fact that the body is not producing insulin, therefore insulin is required. So with type 2, however, you are producing insulin, but it's not being utilized properly. You're not responding well to it because of usually the resistance. For many people, when they lose weight, they become then more sensitive to that insulin they're producing. But again, as I mentioned, the reason we're having this conversation even today is the fact that the longer people live to manage diabetes, all the high glucose can damage a lot of things, including the pancreas. So if the sugars remain high for too long, you find that the pancreas start to give up as well. So really important that we, you know, if one is diagnosed, or if you're told you have pre-diabetes, don't wait a single second. It becomes harder the longer a person has diabetes to bear. But it doesn't mean that it's not doable still, just to say, okay? Yeah, so as I mentioned, this is a new thing that we're kind of adding to this workshop, is what we call pre-diabetes. It used to be called borderline diabetes. Now we call it pre-diabetes. This is when the blood glucose levels are higher than normal, but they're not high enough to be given the diabetes diagnosis. So they are the people on the cliff edge. They haven't tilted yet, but they're not the safe.
You know exactly what is going on. There's no way you would let him walk out of here.
Oh, yeah, okay. Okay, I've been asked to mute, sorry.
So what happened outside? Joe Carroll has more followers. Just that.
Okay, all right then, yeah, all good. Right, so, yeah, so with pre-diabetes, I'll just go back, that's it. With pre-diabetes, you're kind of not quite in the diabetes range, but you're not safe either. And it increases a person's risk of developing type 2 diabetes. And what is quite frightening in this stage is there are often no symptoms. If you think about that scenario that I gave about the lock and the key, if you're not responding well to the insulin, what your body tries to do is to produce more insulin. So you find that in this state, people have very high insulin levels in their blood because your body's trying to kind of counter that resistance. So not feeling the symptoms mean your body said, okay, we got this under control, but the question is for how long? And if you think about it, just have another, little, vision of what your pancreas is doing. You're putting your pancreas on overdrive. The longer it's taking to produce much more insulin that you really should be producing, it means that it can pack up any day. And then the symptoms will begin. So pre-diabetes is a state that we really want to be aware of and do something about it as well. Okay, so with pre-diabetes, let's see. That's it, okay. So it's really important that you know your risk. What is your type 2 diabetes risk? And I thought this was a good one to look at because for many of us, we obviously hope that our risks are low, but there's sometimes it comes as a shock that your risk actually might be higher than you think. So if you're white and over 40, you have a higher risk. Whereas if you're over 25 and you were Black, your risk is even higher. It's quite interesting, isn't it? That you're basically 15 years younger than your Caucasian counterpart for your risk of diabetes to increase. Also, if you have a parent or a sibling that has type 2 diabetes, your risk triples. Basically, it can increase up to 6 times. If you've ever had high blood pressure, or if you carry extra weight, especially around the meat, so around the stomach, if you have like fat around there, then the risk of diabetes is much higher. So it's quite a sober reflection here. And at this point, I would just ask if we can have on the chat the link to the checking your risk. So there is a link, anybody can go on that link. Fantastic. You just put in the details it asks you, and it would tell you what your diabetes risk is, and kind of just give you an idea of, okay, what exactly does this mean in real term, of developing diabetes. Again, it doesn't mean that you're going to develop in terms of now, but it's just saying, if you know your risk, if you know you're walking towards a cliff edge, the best thing to do is to walk back. So make the lifestyle choices that help you to walk back from that edge. So what I thought I'll do my own risk. So I'm really I'm making myself vulnerable here. So I did go on the link and I thought I'll check my own risk. And this is the score I got. So I got 11. And basically my risk was the fact that I am Black. That's my ethnic group, which I have no control over. It gave me a 6 score. And having a relative with diabetes, it gave me a 5 score. Everything else was a 0, but that. What is my point here? There are things we don't have control over. And I think we've already mentioned that. What we do have control over, let's really work hard to bring it down. Because if those risks are already high of what you don't have control over, and the ones you have control over, you don't do much, it's really a double whammy for such a person, because you then increase your risk further if you're not watching your weight or watching your blood pressure or, you know, watching your waist circumference, you know. So very important that we are mindful of those factors, and we can focus on the things that we have control over. And that really brings us to my next slide, looking at how can we prevent diabetes? How can we manage this very, you know, unique phase of pre-diabetes where you don't have a diabetes diagnosis? There's so much you can do. Now, I'm not saying it's easy, but you've got so much to do. First things first, as the host has mentioned, having your annual check. We've already seen that for people of Black and ethnic minority groups, you know, Asians, from the age of 25, really, you want to start checking. You want to be, you know, having a chat with your GP. So for those in the UK, for those outside the UK, your, you know, whatever doctors you're signed up to, just have a blood test done. You know, ask for your HbA1c, or it's called A1c in America and other, you know, parts of the world. It's called A1c. Again, you've got Google there as well. I know I don't recommend just going on Google, but sometimes when you get your blood test and the GP say, oh yeah, you're fine. Although some GPs don't do that, but there are times, and I tell you why. As a healthcare professional, I shouldn't say this, but I'm going to take off my nursing hat here and just say, your GPs are stretched thin. They are busy. And if you've got someone whose limbs are hanging off and you're still standing, they're going to go to the limbs hanging off. So my point is, when you get your blood test, you have a look and see whether it's okay or not. As part of my role, I do what we call an expert witness role, where when things go wrong, I'm asked to write reports about what could have been different, or if there was any breach of duty, any negligence. And there was a particular case I was asked to write, and was a person who had a blood test done, I think was like 5 years prior. They had pre-diabetes and their GP didn't tell them they had pre-diabetes. 5 years later, they were diagnosed with diabetes and neuropathy. So that's when the nerves get damaged. What did they do? They sued the GP because the GP didn't tell them, because they felt like if they had been told 5 years before then, they could have done something about it. Likewise for us, having those annual checks, I call my GP. My GP, they know me then. I used to be just like, all right, let's get the blood test done. I want to get my vitamin D. I want this. And, you know, they do it and I chase up the result. I don't want, oh, it's fine. No, I want to see the result for myself. Likewise, you can also do that. I think, as the host has mentioned, on the one-to-one coaching that we're also looking to do, we can also support. Now, obviously, I'm not your healthcare professional, so I will not have your health record. So I can't give you that tailored advice. However, having your blood results and knowing what it should be is really important for you to make, you know, the informed, you know, decision. So so enough of that said, but it's really important to have your annual blood check. So for people in the pre-diabetes state as well, that's what is recommended, to have your annual blood check. Reduce the weight as well, body weight by about 10%. In the next section, we're going to look at a study called Direct Study, amazing land-breaking study looking at diabetes remission and, you know, how body weight impacts remission. So reducing body weight at pre-diabetes stage is a sure way to reduce the risk of diabetes. Another thing I probably should mention here is the National Diabetes Prevention Program. That is a free program for everyone in the UK. You can self-refer, your GP can refer you. I think for those outside of the UK, you can also maybe look at some prevention programs, maybe online or something. But basically, it's a one-year program that really works on goal setting. You know, just it's like a bit like a boot camp, just really getting you to overhaul, change what you do, how you do things. Amazing program. I definitely recommend the National Diabetes Prevention Program. Helps with weight loss. You know, exercise, activity. When I say exercise, I don't mean treadmill because the image of bouncing on in the gym, boom, 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 not for everyone. If you can do that, fantastic, great, build those muscles up, you know, absolutely. But for many people, it's just as simple as walking, you know, 30 minutes, 5 times a week can be effective, especially for those of even with bad knees. Very, very important. My 5-year-old son said to me the other day, "Oh, I'm really tired, Mom. We're walking." I said, "Yeah, because we're exercising." He said, "No, we're not exercising. We're walking." I was like, interesting how a lot of us think that just because we're walking, we're not exercising. Obviously, he's a child, but no. Even things like putting your laundry out, just moving. As long as you're not sitting for long period of time in front of the TV, having your, you know, TV dinner and all of that, you really need to move around and monitor that movement. And of course, limiting our sugary drinks, refined carbohydrates, which we will talk about in the second session as well, increasing vegetables, fiber intake. Again, that's one of the new additions to this workshop, looking at fiber. What exactly is it? Whole grains, you know, how does that play in our dietary choices? So these are really the 5 ways that we can prevent diabetes, you know, potentially even revert diabetes. A lot of these principles still come into play. So that really concludes my presentation. So I'm so pleased because I'm bang on time with a minute to spare. Yeah, so we will now go into the question and answer session, and I'll just come off the screen and then we can get the host to feed some questions and hopefully we can answer before we go on our break. Thank you very much.
Wow. Thank you, Norma. Thank you so much for elaborating on that, you know, just in addition to, you know, my story. And for those who joined, you know, after, you know, sharing my story, I did, you know, talked about my diagnosis in diabetes and how much, you know, I adapted to, you know, modification of life changes, lifestyle changes, you know, to improve, you know, my blood glucose level, which I was able to achieve by the grace of God, and the motivation, you know, and the inspiration, you know, from, you know, others, including my sister, and getting a lot of knowledge. So I believe, you know, for those who have listened today, those of us, I believe we've been able to acquire knowledge from what Norma is already shared today. And so we now create an opportunity, you know, for question and answer time. And some people have already, you know, shared some of their questions privately online. I think the first question was because I did discuss about my screening, the importance of screening, you know. And so the question is that when did you do your screening? Was it at GP or private hospital? You know, for those in the UK, is it free to just, you know, approach your practitioner, your GP, your doctor, and it's free of, you know, just ask for, you know, a blood check. I know usually like normal shared is very busy. Just keep asking, keep calling, you know, the receptionist to book an appointment. Eventually you have it done, you know, so that's the first step. So within the UK, you don't have to pay for it. But for those outside the UK, I would suggest, I know it's quite expensive, especially for those of us for those people from developing world, you know, it's not affordable for some. But if you could, you know, try at some point, you know, to approach, you know, your local laboratory, which I believe they have local laboratory around in your community, and just go for it, pay for it, because it will save you a lot of cost after. You know, paying for that blood test, you know, will save you the cost of treatment after, if you think about that. You know, so that's a question answer for that, for those who are thinking of going for screening, you know. So I would suggest, you know, you do that. And as I believe that question is being answered. And as somebody did ask as well, that could you let me know more about the details about the changes to Sharon's diet and lifestyle? Any particular superfood or any good, you know, exercise? Yeah, there was a drastic discipline in that area. Like I earlier shared from my story, coming from a very large household where you cook a lot of carbohydrates, high complex carbohydrates every day. You cook every day eventually. So I was used to that lifestyle. Actually changing was a challenge. It wasn't an easy journey. I will let everybody know. But knowing, the outcome of it was the motivation behind it. I believe so much in a diet, and I believe our food is medicine to our soul, our body as well, to our body, yeah? So I took on as my food, my diet as a medication, a form of medication. In the sense, I started to watch what I eat in terms of reducing the quantity of my food. Firstly, when I studied around diets, I realized that rice wasn't a good option if you have a history of diabetes. It will actually increase your blood glucose. So I started to reduce my portion, number one, gradually. Even being a mom, when I cook, I started reducing it. Eventually, I went for substitute to rice. Started going cauliflower was a substitute. I know it doesn't really taste really good for some people. So I started to build on my taste board around my mouth in terms of getting used to, this substitute. And I went around in the shop as well. There are some low carb rice as well. It's important to read the label. I don't know if Norma is already mentioned when you go, search. I started looking at labels.
We'll do labels in the next session. Yeah.
Yeah, so low carb of alternative rice. So eventually, and also based on my belief as well, I prayed about it. Sometimes you struggle with your flesh, but because I believe so much in the power of prayer, I was able to fight that habit of my craving for rice. Actually, my craving for rice actually, should I use the word disappear or reduce? So I could cook rice without eating. I would eat my alternative, substitute. So that was my option. Like I said, it might be struggle for some people, but the outcome of it is what matters. What is your aim and objective? What are you pursuing? So my pursuit was that I want to live long. I want to be fit. I believe I have got so many assignments to complete, So I needed, to be fit to get there. Like I've earlier said, our body is the temple of God. You've got to look after yourself to be able to achieve your potentials in life. So that was my goal, which actually helped with choosing food, So that's just my encouragement. It's not easy. It's a discipline. Discipline usually comes with a bit of, struggles. So my encouragement is that keep trying. You will eventually get there. And for the exercise, as earlier mentioned, is a struggle to go to the gym, because I'm a very busy mom. I've got so many activities. I've got to balance life. So I realized, I paid for gym, but most often I don't go to gym. So what I'll usually do after food, I've got a space in the kitchen, sitting room, just take myself aside, after eating for a few minutes, after allowing my food to settle down, just have a quick jogging on the spot, sometimes 10 minutes, because it's recommended at least 20 minutes exercise would help reduce your blood glucose, or 30 minutes exercise in a day. So usually I know I can't get the 30 minutes exercise in a day. So I'll usually break it in different sessions, like 10 minutes in the morning or afternoon, whenever I've got time. Later on in the day, I add on to it, and also going for a walk as well, casual walking as well. You don't have to take it as a routine. So those were part of my exercise. So it's very important that when you finish eating, don't sit back or just go straight and sleep. And so it's important that you shake yourself, just walk around to allow the glucose, reduce. And then watching the quantity of your diet as well is very important. If you're eating eba, rice, from those of us from the Black community, try to reduce the portion. Whatever food you're eating, reduce the break it in smaller portions. It does help as well. So I believe I've answered that question. Like I said, climbing the stairs as well is another thing. Climb down the stairs, go for a walk with your children, with your dog, if you've got dog, just create that, habits of exercising. So it's been very, very effective. It actually helped because I had a meter to monitor myself. Apart from watching what I was eating, I had a meter to monitor how significant with the activities I was doing was impacting on my blood glucose. So after exercise, I'll usually check my blood glucose to see how much difference I've made before food and after food, and then during, usually after 2 hours of eating, there's a collection of blood glucose in your blood after 2 hours. And when you do exercise, check your blood glucose again. You see that your sugar level is actually reduced. So that's a question answered there. And another person, I believe I've answered those questions. Later on, I will add on to it. We still have another question and answer time at the end of this session. And another person asked, is there a limit to which if you pass it, your diabetes is reversible? So I'll give that to Norma to answer.
Okay, sure. Yes, I think, and it says specifically the number on the scale. And okay, there's another type 1 and type 2. Okay, so it's a very, very interesting question, because 10 years ago, if you asked me whether diabetes could be, reversed, I would say, I would love to say yes, putting my faith hat on, but, medically, no. But you know what, as I said, there was a landmark study, which we'll talk a little bit more about later on, a direct study, which showed that people who had diabetes, I believe it was 10 years or less, 10 years or less or 5 years or less, I'm sorry now, I can't off the top of my head, had a higher chance of reversing diabetes. So in terms of the figure, it's really about, I think 5 years or 10 years. So the higher, but interesting, you still have the old people who, even after having diabetes for over 10 years, could reverse the diabetes. But in general, they found that the shorter the time, so I'll probably say safer level 5 years and below, 5 to 10, so I'm not quite sure, but definitely 5 and below had a higher chance of reversing the diabetes. Okay, now in terms of the other question about type 1 and 2, I think I mentioned it, I don't know if that came before I mentioned it. Type 1 diabetes is when your pancreas is not producing any insulin because it's been damaged. A lot of people with type 1 diabetes have antibodies. It's called GAD antibodies that damages the pancreas. And because of that, their pancreas can't produce insulin, and they don't have obviously any insulin. So they're type 1. So we don't really have this conversation about weight management per se or other therapies because they need insulin. So they would usually automatically go onto insulin. Whereas type 2 diabetes, as I mentioned, is where your body is still producing insulin, but it's not being used properly because of the resistance from weight gain and other factors. Yeah. So hopefully that answers your question, Karina. Yeah. So if I probably just because of time, because we're supposed to be having our break now, should I just go through the questions very quickly?
Yes, go through the question.
So there's a question about how do you know if your pancreas has packed up? Okay, so very quickly, for people who have diabetes, one of the way you know is when the medications that were working, say 2 years ago, the same thing, you haven't changed your lifestyle that much, it's no longer working. So for many people, I think as the host mentioned, some GPs will say, right, let's have things like metformin, a tablet. They might be on the metformin for like a year or two, or even within that first 2 years, other medications are added. But if you find that those medicines that were working for you 3 years ago or 2 years ago, it's no longer working, it means the pancreas function has declined. Now, for people who did not have diabetes, obviously like type 1, the way we know that the pancreas is packed up, when they're diagnosed with diabetes, it's often very dramatic. It's either they collapse, they have what we call diabetes ketoacidosis, DKA, where there's no insulin, their body's producing a lot of ketones and makes their blood acidic. So straight away, we know that this is a type 1, and we will start them on insulin. So that's how you will know that the pancreas is packed up. Very quickly, the sugars will rise up, spike, and then, it's only insulin that person would then respond to manage their blood sugar. I think someone asked about screening is usually 40 years. They should make it mandatory for 25. I agree, but I think if you think about it, in this country, especially in the UK where we have the NHS, there's a lot of cost cutting. And also because I find that people who take responsibility for their health get the most out of their GPs. So I absolutely agree that the screening age should come down, but the truth of the matter is that even at 40, some people are still being chased. sadly. You know, even at 40, people are still not responding to say, right, let me go. It's a bit like you go for your car's MOT every year. Why would you not do that for your own body? So really, it's about making sure that you have your own MOT where everything is checked out and, you know, and resolved. Okay, so I'm just thinking, do we have any more, one more minute?
Yeah, one last one. The difference between type 2 diabetes and the one diagnosed in pregnancy.
Okay,
Yeah.
So if you remember the slide when I looked at the types of diabetes, there's a diabetes called gestational diabetes. I didn't really touch much about on that rather. So what's interesting is in gestational diabetes, you will find that the HbA1c is actually fine. And that's why in gestational diabetes, it is done with what we call a glucose tolerance test, OGTT. So for many people, if you've ever been like invited by, so again, I apologize to those who are not in the UK. So in the UK, in pregnancy, there's certain screening tests you do. If you're Black, you've got a family history of diabetes, is automatic. Your midwife will put that on your book. At 28 weeks, you do what we call OGTT. Because OGTT will pull up if you're, because pregnancy, the placenta release hormones that make you resistant to insulin. So at 28 weeks, you get your OGTT, you have a kind of like a Lucozade, high glucose, they check your blood to see how your body has responded to that glucose. Because if that's not picked up, it can cause stillbirth, it can affect the outcome of that pregnancy. So the major difference, just to cut to the chase and answer that question, in gestational diabetes, your HbA1c might be fine. Reason being that the HbA1c picks up glucose over the last 3 months. So obviously when you're pregnant, prior to pregnancy, your blood glucose may be well controlled. So HbA1c won't pick it up, whereas the glucose tolerance test will pick that up at that point of pregnancy. So hopefully that answers the question.
Yeah.
All right then. We were quite generous with the break, so hopefully people had a lovely time just stretching our legs and getting some fresh air. So we're gonna get started now. Yeah, I'll just give it 1 more minute because we did say 25 past. So 1 more minute. Are you happy for me to just start with the second session?
Yes, you can carry on. I believe everyone is joining in slowly. Carry on.
Okay, yeah. Perfect. Hopefully people understood that it was a break. It wasn't the end of the session.
No, I hope so.
Yes, because I think quite a lot of people have logged us. So hopefully, if you know any originally here.
Norma, mute everybody. Mute. Yeah,
we'll do. We'll do.
Thank you.
You took my tissue. Hi, Ashley.
Lovely. Okay, perfect. So can you hear me? Lovely. Okay. So we're going to get started. If you know anyone who's kind of just locked out, just send them a little reminder that we're back so they're aware. So we're going to get started now. So this second part is when we're really going to be delving into the practical aspect of management. And it would be such a shame for people who have been in the first part, probably should have really, highlighted the fact that, the second part is going to be looking at the actual management. So hopefully we'll answer some questions around, carbohydrates and things like that. So without further ado, I will get started. So as I mentioned, this second session, we're going to be looking at the actual management for both diabetes and pre-diabetes. We know that diet and physical activity is really the bedrock, the cornerstone, the foundation of getting it right. And medication is often where there is a diabetes diagnosis. I think there was a question on medication from the other session, so we'll be looking to answer that in this next section. So we'll be looking at all three, a lot of emphasis on diet, and that's just because it really does make the biggest impact. Okay, diet makes the biggest impact in diabetes management, in reversing diabetes and preventing diabetes as well. The reason I'd like to mention this is because I don't know about you, but when I go on that treadmill, I'm there 10 minutes, I'm literally breaking sweat. I look at that treadmill, it's saying 50 calories. I'm like, what? 50 calories for 10 minutes of exercise? But if you think about it, if you had a bar of chocolate, it's over 100 calories in the space of 1 minute. So you find that obviously it's much easier to get the calories in than to actually get rid of it with exercise. So really looking at our calories intake is important. Okay, so we're going to do something a little bit interactive now. Following on the question that was asked, I think I gave it away in the lab. But anyway, for those who, it means this is to test if you were listening to me and if you remembered what I said. I've got a question. Okay, so we've just to make it a bit interactive, we're gonna go into our next slide. Yeah. So question is, can type 2 diabetes be reversed? If you just put your answer into the chat group, the chat, and the host will collate it. So just 1 minute. Can type 2 diabetes be reversed or not? What do we think? Okay. Yeah.
Hold on, I'm just collecting
Okay. Yep.
the response.
If you're not sure, you can just say unsure. That's fine. It's a response. So.
Yes. I think I got 1,
Okay.
2, 3, 4, 5, 6, 7 yeses.
Okay, we'll take that then. Okay, lovely. Great. It means you were all listening. Thank you for participating in that. So the answer,
and somebody said it depends on how far you are. And it takes us to another question that was asked previously, that how far you are before you can have it reversed.
Yes, absolutely. There are the little factor there of how long you've had it for, but in general now, I think as healthcare professionals, we can officially say that type 2 diabetes indeed can be reversed. So that's a great, I think for many people, it really brings hope, because it can feel quite demoralizing if you feel like whatever you're doing is not going to be effective. But we know that what we're talking about here today can make a huge impact. So yes, type 2 diabetes in most cases can be reversed. In some cases where, especially where I think in the case, so let's just be clear here. The case where type 2 diabetes can't be reversed is if the pancreas get damaged. Because in that instance, what we're talking about here in terms of diet, physical activity, is to help with weight loss, which can then improve your sensitivity to insulin. But if the pancreas that produces that insulin packs up, think about it, it's not gonna be, what's the word now? You can lose weight, absolutely, it's great. Obviously, there are other benefits of losing weight with cardiovascular risk and things like that. But ultimately, if your pancreas is not functioning well, you may not see that reversion, happening. So protecting the pancreas very early on, I think that's the key message, very, very important. Okay. Okay. So as I mentioned earlier on, the study that we're basing this information about diabetes remission on is the direct study, which show that 89% of the participants, it's about 7% of the whole group, who had 89% of the participants who lost about 5 kilos of weight loss. So about 7% of those actually reversed their diabetes. That's it, reversed their diabetes. And for those who lost 5 to 10 kilogram weight loss, 34% reversed their diabetes. So what you will find is that the higher the weight loss, the greater the chance of diabetes reversion. So for those who lost 15 kilos of weight, 86% of those people in that 15 kilogram weight loss group reverse their diabetes. So it's really encouraging to see that what we're talking about here indeed is effective. And I love what the host mentioned earlier on. When I do like when I talk about, you know, on one-to-one, you know, when I have that conversation with whether my patients or anyone that I'm helping to, you know, manage the diabetes, I always say, you need to understand your reason. You need to know why you're doing what you're doing, because the journey you're embarking on is going to be tough. It's going to be hard. And it's that reason that will keep you when things get difficult. So for many people is, yes, you know, death is inevitable. But, you know, having a healthy life where you can obviously run around your children, you know, do things that you feel like is your purpose. It's really important that you know your why, because your why will be the anchor for when you set your goals, when you set your action plans. Having your why is very, very important. So with the direct study, we know that people who lose weight, significant weight loss, had, you know, HbA1c below the WHO diagnostic threshold, which is 48 millimoles. If you remember back to the slide, and when we look at pre-diabetes, 48 and above would be a diabetes diagnosis. So people who lost quite significant weight loss fell below that 48 millimole threshold. And also they found that their fasting glucose levels also dropped down as well. So we're going to come really into the crux of what this session is going to, what this section rather is about, is looking at the tools available to us to better manage diabetes and to prevent diabetes for those who don't have diabetes. So we're looking at our macronutrients, so protein, fats, and carbs. These are our main macronutrients. You can say these are like our foundation for dietary choices. So the food that we, you know, the food choices we make, macronutrients are the foundation, and is broken down into carbohydrates, protein, and fats. These are the three main food groups that we would choose from to obviously get, you know, for our health and well-being as well. So carbohydrates is one of the main food when we talk about, you know, glucose management. Carbohydrates is one of the main food we talk about, and the reason being that it is the only food group that would cause your body to produce insulin. Is the only food group that will cause, that would, you know, elicit an insulin response in your body. So now it doesn't mean that it's the most important, but when it comes to glucose management, it actually is. Okay, so carbohydrates we know is broken down into complex and simple carbohydrates. Okay, very quickly, I'll just break it down for you. So complex carbohydrates are ones that have, you know, multiple structure. And what that means is a kind of carbohydrate that is harder to break down. Okay, now it also has starch, which is what your body would, you know, respond to and produce insulin, but it has other goodness as well. You know, carbs are loaded with other goodness. So we don't demonize carb, but we generally say it's something to be mindful of. Okay, so complex carb has lots of structure, whereas simple carbohydrates are the ones that are easy to digest. They often contain, you know, sweetness, or like your sugars, they're sweet to taste, and they raise glucose up very quickly, whereas the complex carb don't raise glucose up quite quickly. I love to mention this because during the course of my obviously as a nurse, I meet a lot of people. I have these conversations, you know, I do all this teaching, and people will say to me, you know what, I've cut back on my carbohydrates. I have cut back, you know, I've cut back on it. I'm no longer having sugar in my tea, which is great. I'm no longer drinking fizzy drink, which is fantastic. But but they forget the rice, they forget the pasta and the potato and the bread and all this lovely food that makes, you know, the bulk of our food. They forget that. So complex carbs, and when I talk a little bit later on about quality versus quantity, we will look at that very quickly. So just a take-home message is carbohydrate has 1 gram. For every 1 gram, you have 4 kilocalories. What that means is if you're looking at calorie intake in a day, for women is 2,000, for men is 2,500. You find that carbohydrates, when we compare it to fat, which is more dense, you would need less fat and you get more calories, if that makes sense. So basically, carbohydrates has 4 calories per gram of carbohydrate. Okay, so as I mentioned, very, very important when we talk about carbohydrate, we're thinking about insulin, thinking about glucose management with it. Okay, so quick one on whole grain. You may have heard of the word whole grain, you know, a lot. So for many people, it might be because, okay, is this healthy? You know, what exactly does whole grain mean? Whole grain basically has 3 parts. You have the bran, endosperm, and germ. It's all locked into this grain. Okay, now what happens in refined grain, for example, your white bread, your white flour, they often remove the bran and the germ, which is interesting. The bran is the bit that has the fiber, and the germ is the bit that has the nutrients, the vitamin E's and the vitamin B's and those healthy fats that we need. And all you're left is endosperm in the refined, which is the starchy carbs, has some proteins, vitamins, but it doesn't really have that fiber. Okay, so if you think about what I said earlier about pre-diabetes and increasing your fiber intake, we're coming to realize quite quickly that fiber is very important in reducing the risk of diabetes and other, you know, conditions like heart disease. Because what fiber does is, apart from weight management, so I've got on the side here what fiber does, it also helps to control your cholesterol, your weight, and your blood pressure. All of these things are factors involved in causing diabetes. Very interesting. So fibers can reduce your risk of hypertension, heart disease, and diabetes. Now the question then is, hold on a second, if the mantra is that we're supposed to reduce our carbohydrate, how then do we improve the fiber? So you will find that there are other sources of fiber that doesn't, so when I say other sources, there are sources that have high fiber but low carbs. So things like our seeds, they're very high in fiber, but they don't really have as much carbohydrate as maybe your bread, for example. So it's really important that we're mindful of this. And when you obviously go out shopping, think about whole grain. It's a great way to obviously increase your fiber and, you know, get the vitamins and all of that, but you're not having just the starch, which is what refined carbohydrate is about. You're just getting the starch without all that goodness. Okay, so examples of whole grains, we've got barley, bulgur, millet, quinoa. So for those who are into superfoods, I think I mentioned there was a question around superfoods. Quinoa is supposed to be one of the superfoods, you know, and sometimes I think, as the host mentioned in her story, for many of us, we may have our staple, what we enjoy eating. You know, you have the eba, you have the pando, for Asians, you have the chapati, you know, you have all this sort of carb-based meals. Sometimes it would require you to just look outside of your typical diet. So, you know, things like chickpeas, they're a great source of fiber, but they don't also have the carbs, which is great. And then, you know, so really looking outside and looking at recipes. Okay, so for example, I look at burger. Okay, that's not typical diet for me. Rice would be something that I would generally eat, but I know that these are very healthy. So what I would then do is, okay, go and have a look and see how can I make this sort of food? You know, how can I, you know, cook this sort of food? So it's really important that you go outside of your typical diet to get, you know, the goodness. Okay, so as I mentioned, another way of working in working out, in terms of your fiber intake, is looking at the ratios. Really interesting. When I look at the food labeling in some slides down, I will talk a little bit about fiber and looking at your carbohydrate ratio to fiber. That would tell you how rich in whole grain that food you're eating. Very, very interesting. So we'll look at a little bit about that later. Okay. So let's look at our protein. So protein, like carbohydrates, for every 1 gram of protein, you have 4 kilocalories. Again, for those who might be thinking of watching their weight, that's something that, looking at your calorie intake. And just to mention about calories here, it's really important that we think about it in a very simple terms, and we call it the energy balance. Very simple, simply put, if you're taking in more energy than what you're letting out, you're going to put on weight. If you're taking in as much energy as you're letting out, you're going to maintain your weight. So for some people, your journey might be, I just want to maintain the weight that I am on. So you think about, what are you taking in? What are you giving out? You get a balance. If you are actually taking in less and you're giving out more, you're going to lose weight. So for some people, you might be on that journey and need to lose weight. So you're not going to be thinking, okay, no, because the recommended calorie is 2,000 for women, I'm going to eat 2,000. No. And that's what for those who might be just joining us, we talked about that study, that with the remission study that we looked at. One of the things they did was calorie restriction. They restricted the number of calories, increased activity, and then they created weight loss. For some people, you might start off with wanting to lose weight, you lose all that weight, then the next will be to maintain that weight. Because for many people, you lose weight within 6 months, the weight is back on. And that's always saying that healthy lifestyle is not a fad diet. It's not something you do today. Take your, yes, there will be times when you fall off the proverbial wagon. Absolutely. It all happens to us. But you need to get back on that wagon and continue that journey. So really important when we're talking about calories, that you're really thinking about, okay, how do I maintain that, weight loss? How do I actually lose weight? And I've got some really interesting pictures on there, just to talk a little bit about those pictures. You see there's some seeds there, there's some nuts there. You've got almond nuts, is packed full of protein. But interesting, almonds are one of those nuts that also rich in fiber. So you still get that, that carb there, but it's not as much, but it's packed full of fiber. You have other seeds like chia seeds. Chia seeds are a fantastic source of fiber. You can add that to your breakfast, your yogurt or that sort of thing. You can, increase your fiber intake in that way. And then we've got our fats. Now, fats does get demonized. When you think about weight loss, the first thing you want to cut fat, for obvious reasons, because we can see here, compared to protein and carbohydrates, fats have 9 kilocalories per gram, double the calories of protein and carbohydrates. Interesting. So what that then means is, for people who want to lose weight, yes, cutting back on fat is seen as a very sensible thing to do. But what I want to bring here today is also looking at the types of fat. There are some good fats. If you look at that picture, you've got your avocados there. There's a great source of monounsaturated fats. Fish oil as well. They're rich in good fats. So you do have the good fat. It's just making sure that you're reducing that bad fat, like the trans fat, again, from fast foods, you get a lot of trans fat. You really want to get rid of that. Also, if you think about your food as a whole, one way to reduce the calorie of your food is obviously also the amount of oil in that food. So that's what the host also mentioned, is there's a lot of kind of drastic measure, because for many of us, especially those of African background, you cook your stews and you have that beautiful oil swimming out, at the top. It is delicious. I love it. I'm not going to lie, but it is not as healthy, because for that same stew, reducing the amount of oil can reduce the calorie in that stew. So something to be mindful of. And then for some people, actually think you can cook with olive oil These are also very good source of mono unsaturated fat, which are these are the kind of fats that help your heart as well. So they're the good fats. It's something to be mindful of when it comes to fats. Okay, so as I mentioned, if there are any questions from what I've talked about earlier on, please pop in the chat. No question is embarrassing. If you don't want to put it into the group, just put it to the host. So you can find the host there. Yes, and then just send her a question directly and we will answer those questions. Okay, so the next group we're going to look at is not quite food, but it's very important. That is liquid. Water is so important on this journey of healthy lifestyle because our bodies contain, high percentage of water. We know that water is important in flushing out toxins from our bodies, transporting nutrients. So water is very, very important in making sure also that we're not eating too much. For some people, they find that actually once they've eaten and that satiety, like the brain is saying, you're still hungry. Just having a glass of water can actually help to just put a stop to that, feeding time. So water is important. Also, on the notes for water, you can have raw vegetable juices, teas. So for people who have herbal tea, that will count as your water intake as well. I would say fruit juices, be careful with them because they contain carbs. So for people who can actually, who like smoothies, the notes on smoothies, there might be questions around smoothies. I would say vegetable smoothies and a piece of fruit, for example, would be a good, smoothie. What I tend to find is people use a lot of fruits in the smoothies, super sweet. I would say be careful because your fruit smoothies contains a lot of fructose. That's the sugar that's the natural sugar in fruit. And what happens, your body doesn't really care what source of carb you're giving it. It will respond in like manners. So what I tend to say is you get good minerals and vitamins from vegetables as with fruit as well. So you can limit the fruit, increase the vegetables. And also it's about portion control. I think it was mentioned before. I'll talk a little bit about, portions later. You're better off spreading out your fruits over the day. So if your aim is to have, say, 3 portions of fruit a day, which is great, and 5, 6 of vegetables, be intentional. You can have 1 piece of fruit in the morning, another in the afternoon, another in the evening, and your vegetables as well. Rather than having a beautiful fruit cocktail, it looks very healthy, but for a person who is trying to manage, their blood sugar, it would not be the right way to go. So spread the fruit out. That way you give your body the capacity to deal with the glucose from that fruit. So hopefully I haven't digressed too much, but basically, yes, water, very, very important on this journey. Okay, so I'm just going to go to the next slide. Let's see. So there is something called the nutrient factor, and I love this because it really just helps you to determine what you're eating. Is it healthy? Is it not? If what you're eating answers any of this question, then you're in the right track. Does it have vitamins? Because we know vitamins protect, it cleanses, it nourishes. Is it full of minerals? Minerals support biological functions of your bodies, like your bones and things like that. Is it rich in antioxidants, which provides protection from cancer and things like that? So some of the antioxidant food, you can even Google. I love Google, just Google antioxidant food. The reason that's important is because I have to mention, as I said before, there are people from other parts of the world. For us in the UK, we have access to a lot of fruits like your blueberries, your strawberries, pomegranates. These are a fantastic source of antioxidants. But outside of the UK, you may have an alternative. You may have local fruits, or, local vegetables that are rich in antioxidants. When you Google it, you'll get that information. So that way, you can tailor this advice that I'm giving and apply it to your life individually. Also, is the food rich? Does it promote, good enzymes? because we know enzymes help in digesting and breaking down food. I mean, some people might have heard of the term gluten. Is a very popular buzzword, oh, gluten, is it healthy? Is it not? We know that some people are allergic to intolerant, that's the word. They're intolerant to undigested gluten. Gluten is a protein in a wheat-based meal. And if it's not well, digested, it can cause inflammation. So people may get like celiac disease from such inflammation. But generally, our bodies, for those who don't have any intolerance, glutens are actually healthy. And our bodies produce enzymes to break down this gluten and get the goodness out of it. Also, is the food rich in fiber? So we talked a lot about fiber today, and that's because the general consensus is that we are not eating enough fiber. That is the bottom truth. The recommended amount of fiber a day for a woman is 30 grams or thereabout, and I think a man is 33 grams thereabout. The truth of the matter is, for many of us, we're not even doing half of that in a day. And we know that fiber helps to cleanse and detoxify. How? Bowel movement, simple. Fiber has also been shown to reduce some bowel cancers, like, some cancers like bowel cancer. So really increasing our fiber intake is so, so important. I was going to show a picture of some seeds that I get, but I don't have it. I'm so sorry. Maybe I'll see if I can get it in the chat or something, but you can increase your fiber intake with seeds. Some days I might not fancy a breakfast, but, yogurt, and just add some, seeds and some like hemp seed, linseed, sunflower seeds, chia seeds. They are great source of fiber. So in that meal, I'm interested in my fiber intake. I don't have to go for like a sugary breakfast cereal that promises me fiber. I can get it from my seeds and nuts. So fibers are very important. We talked about oils. They lubricate our tissues, joints, and skin. So very healthy oils is what we want. And finally, water. Water, very, very important. Again, if you have any questions, please pop into the chat and we'll be looking to answer it very soon at the end of this session. So again, to simplify things and also to help you when you go to the market, making your food purchases, think about the macronutrients you're about to buy. So if it's a carbohydrate, is it healthy? Is it unhealthy? One way you know if it's healthy, if it's a complex carb, which I've talked about earlier on, it's a much healthier form of carbohydrate. Is it whole grain? I'll talk a little bit about whole grain when I talk about food labels, so I'll leave that out. Is it colorful veg? Interestingly, colors do matter. For example, your blueberries has the color itself. It's actually has some properties, or should I say chemicals, that reduce the risk of diabetes. Interesting. I mean, and this is from my own research, because we've always recommended to people with diabetes to go with more like berries than your mangoes or like your pineapples or bananas. They are higher in like natural sugars, whereas your berries, they're great, source of antioxidants. They're low sugar and rich in fiber. So you can't, so things like, so as I mentioned, colorful vegetables, absolutely key to, a healthy macro nutrient carbohydrate, and greens, mushrooms. And what I tend to say to my patient is, what do you like eating? I might say tomatoes. Oh, I don't like tomatoes. Okay, what do you like eating? Once you identify what you like eating, make a plan to have more of those good stuff that you like eating. And for the things you don't like eating, I would still say, try from time to time to eat it. Things like beetroot. I'm not a big fan of beetroot, but I know that it's great with managing blood pressure. So from time to time, I'll have a beetroot. So just find out what you like eating. My son, he loves beetroot. Even though he's a very fussy eater, he loves beetroot. So I'll give him beetroot and I'll share the beetroot with him. So just know what you like and have more of that. And of course, the unhealthy macro nutrient carbohydrate is processed food. So processed food, refined grains in our white bread, you know, having like a whole meal, whole wheat, seeded bread, much better. Again, this is one I would recommend, like, you know, brown rice is great. I don't eat much of it, I have to say, but it's definitely, I'm on that journey to include that in my diet a bit more. So for fats and oil, again, mainly unsaturated fat. So things like extra virgin oil, almond, linseed, avocado, these are great source of monounsaturated fat. And then of course our bacons, cured meat, trans fat in the chips. So fast food chips, you get trans fat in it because the oil they use in frying the chips has been processed over and over. And of course the biscuits, crisp and hot dogs, it's definitely a no-no. And then we have our protein. So healthy versus unhealthy. We have our nuts, seeds, lean meat, and bacon and cured meat. And I think a friend was saying to me the other day that she was eating quite a lot of nuts, obviously, which she enjoyed, but she found out that the weight wasn't that great. Shifting the weight. So, and then I said, seeds are great alternatives. They don't taste as great as nuts, I have to say, but they're great in terms of you get the goodness, you get the fiber, but you know, you're not getting that much calories in the seeds. So really balancing it up. And then when you find out if you mix your seeds and nuts, it stops you from eating too many nuts. So that is one little tip I normally give for people who are trying to cut back. I say, have more of the good stuff, because when you have more of the good stuff, it leaves you less space for the bad stuff. It's just a general principle that I find works for many people. So I'm going to talk very quickly on food labels. I find this very interesting because when we've had all this conversation, the question is, so where do I start from? How do I know what is good? How do I know what is not good? Now, the food labels that I've looked at today are mainly like breakfast cereal, because that's where you get a lot of promises of, yeah, this is healthy for you. Is it really? So first tip with food label, I say, and again, I apologize for those not in the UK, but if you're, you know, many Western world, they'll have labels on the food. I often recommend you start looking at the per 100 grams. Don't look at portions, because a portion, and that's if you look, I don't know if you can see my screen well, one has a 40-gram service, another has a 30-gram service. Servings can be misleading because you don't even know what serving you're going to have. Instead, if you look at 100 grams, it tells you, is this food high in fiber? Is it high in whole grain? What am I getting here? So, and also, but again, I haven't quite got labels on other foods, so I apologize, but just a little tip on reading labels, very important that you look at per 100 grams. Hopefully that makes sense. Okay. Now, what I wanted to actually do with this label is to bring that concept of how do you know a food has whole grain? Look at the fiber ratio. So example, I've got between the fruit and fiber and bran flakes, interesting. Both have similar grams of carbohydrates, 69 in the fruit and fiber and 64 in the bran flakes. Same amount of carbs. But what's interesting is bran flakes has less amount of sugar, it's 14 grams compared to 24 of fruit and fiber. And then the next thing, bran flakes has 17 grams of fiber. That is huge. For most, I mean, I can assure you, if you look at other labels, very rare do you see that much fiber. So interesting. And again, we do recommend bran flakes for those who want to increase their fiber. But again, we'll talk about portions. So quantity versus quality. So bran flakes is a quality carbohydrate because it's rich in whole grain. Hence, it's got that high fiber. So when you work here, how do you work here? I've worked it out on the screen already. You basically divide the carbohydrates by the fiber. So the lower the ratio, the better that quality of carbohydrate is better for you. So you can look at the bran flakes is a ratio. So for every 4 grams of carbohydrate is a gram of fiber. That's fantastic. And then fruit and fiber is not bad. So we generally say ratio of 10 and below is a better kind of carbohydrate you want to have. Now, let me bring you my lovely favorite, not my favorite, but it's a favorite of many people, cornflakes, okay? Cornflakes, you can see it barely has any fiber. So it means that this is a very much processed grain, which is lost. Remember the whole grain picture I gave you earlier? And sorry for those who've missed it, but that outer bran is rich in fiber. When you remove that bran, you're really not left with much fiber. And that's what we say. Cornflakes for an adult who's trying to manage their blood sugar, I would not recommend it. Now, obviously, I know we've got lots of parents. We have lots of parents in here who might be saying, whoa, hold on a second. Are you telling me I should not give my child cornflakes? No, that's not what I'm saying. My kids, they don't eat cornflakes anymore. They have like Oatibix and things like that. We're not really talking about kids here, because what you find kids do, they eat, they're playing, they're out and about, they're energetic, they're burning all that glucose. As adults, apart from the fact that our metabolism actually does slow down, so we're not able to break down and burn energy as we used to, we're not as active. So we're not athletes who can burn that energy quite quickly. So it's very important that when we're thinking about our carbs type and quantity at the same time. So it's really interesting. So I hope that makes sense for people who might be thinking, how do I know this is a healthy carb? The higher the fiber in that carb, the better the quality of the fiber. Okay. So I'm moving quickly. I'm mindful of my time. I'm still within time, but I think we started a bit later for the second session than we planned to. So very quickly, a quick summary of, just to make things easy, when we're trying to, prevent diabetes, when we're trying to better manage diabetes, avoiding refined white sugar, refined, white flour, trans fat, saturated fat, and of course the drugs, which I'm sure a lot of people don't. I like to believe we don't, alcohol, tobacco, and this is avoiding them, caffeine in moderation. If you're able to avoid this or just cut them back to bare minimum, you are kind of on that journey. If you remember what I said in the first session, I said, if you think about diabetes as a line, like a graph, and diabetes on one end and no diabetes on the other end, think about where you're at on that line. Are you, and your lifestyle, is your lifestyle pushing you towards diabetes, or is it pushing you away from it? That would help you to make that decision when it comes to your diet. Okay, so again, healthy choices, just to summarize what I've talked about previously. Vegetables are great sources of antioxidant. They're rich in fiber. They slow down glucose absorption, therefore preventing your glucose from spiking. So that's why we mentioned that foods rich in fiber is something that you really want to introduce into your diet, but generally lower in, sugar, because you can get some foods that, they pumped you full of a lot of sugar. You want to be mindful of those sort of food. Lean protein, protein provides necessary amino acids to help your body utilize even glucose. And also, when you have lean protein, you don't have a need to actually inject insulin as well. So protein are great sources of food if you're trying to reduce your glucose and prevent diabetes as well. So when I say lean sources, so looking at your just fish, meat for those who are not vegetarians, these are good sources for you. Again, unsaturated fats or monounsaturated omega-3, these are very good for your heart and your mental health and well-being as well. Last note on whole grain, they contain soluble and insoluble fiber. They suppress hunger, promote glucose lowering. So for me, that's something that I'm kind of personally, is a goal for me to actually increase my fiber intake, because you find that for people who if maybe your appetite is fine, you're quite good at maintaining your carb intake or your portion sizes, you also need to be mindful of, okay, what am I actually eating? Is it good for me? Is it repairing my cells, repairing my system? So fiber is something that we really need to keep an eye on, because a lot of the time we don't have enough of it. And I think one of the questions, so I don't forget, someone asked about, how did the host change her diet? I remember I was having the conversation with her. She said, oh, I found this thing where you can make swallow. So for those who don't know what swallow is basically African food that you eat with soup. She said, oh, I can make a swallow from some seeds. I think it was lean seeds or almonds. I was like, what? She said, yeah, almond flour. I use it to make swallow. I was like, oh, very interesting. So there are lots of, alternatives out there. You just really need to look out for them. You will find them. Again, we're hoping that we can do this on a one-to-one basis where we can obviously support with goal setting and creating action plans towards that journey of coming away from diabetes or better managing diabetes. So quick word on physical activity, because I did warn you that I would talk a lot about diet, but you'll be pleased to know that the presentation is almost over so we can have those questions come through. So quick word on physical activity. Yes, it's great to have fantastic diet and making those food choices, but we know that exercise is very important as well. Physical activity, whatever you love doing. For some people, going out in the field is just second nature to them. For others, it might be just swimming or cycling. Again, one tip I would say is if you maybe take, if you drive, for example, limit your driving. If you can walk, some days walk instead, or if you take public transport, if you get off 2 stops for your normal stop, walk the rest of the way. It's all about being active throughout the day. By the time you finish the day, look at your step counter. For some people who might want to check their activity level, I recommend a step counter, like a watch or some sort. I have one on my phone, which I normally take with me outside. So when I come home, it will tell me, okay, so I'm aiming for, say, 10,000 steps a day, which is the government recommendation. Some days I might do 6 or 8, but if I haven't done enough on that day, so I know that, okay, I'm mindful, I haven't been as active, maybe I won't do as much sitting around, just walk around the house, use the stairs, move around. It all adds up in reducing sedentary lifestyle. So a quick one on the benefit of physical activity. We know it improves your response to insulin. So when we talk about that insulin sensitivity, you're more sensitive to insulin, so which means your body doesn't have to produce as much insulin for same response. And also it means you're protecting your pancreas from overworking as well. So we also know that exercise lowers blood glucose levels, as I've mentioned. It lowers blood pressure and cholesterol levels. If you remember when we talked about the risk of diabetes, if you've had high blood pressure, you need to tighten your belt. It means that you need to work twice as hard as somebody else who doesn't have high blood pressure. We know exercise improves blood pressure. Exercise will obviously control weight. So for many people who have lost weight, you'll find they will tell you that if you don't keep exercising, there's a good chance that weight will come back. So the way I often see it, food, diet will absolutely help you to lose weight. Exercise helps you to maintain that weight loss. Yeah, so just, note on exercise there. So it's really important that we are exercising. We're not, being sedentary, just sitting, not doing much, eating, putting all that energy in, but not putting it out there. And also exercise will not reduce the risk of developing diabetes and the complications of diabetes as well. So these are the benefits of exercise in a nutshell. Okay. So very quickly, this is just a touch on treatment modalities. I think someone mentioned about metformin earlier on. So we can see that the various medications would kind of focus on different parts of our bodies. So things like metformin will work on glucose absorption, so improving your sensitivity to glucose. Hopefully that would actually answer that question, but I can touch on it a bit later as well. We've got some now that help you to pee out glucose, your SGLT2s. And you have the injection, the once a week injection. I think that there's a whole trend on, I think, TikTok, Instagram about this magic injection that you take once a week and it makes you shed all that weight. That is the GLP-1. Obviously, it's got its side effects and things like that, but that helps in reducing, increasing satiety. So it makes you feel full, because obviously when you feel full quicker, you're going to obviously consume less calories. Okay, so very quickly, as I mentioned, oh gosh, I don't know what line this is. Okay, anyway, quality versus quantity. it's very tempting for us to go, we've got all this amazing information, right? Okay, I'm going to have a nice bowl of whole grain, cereal, great. I would just say err on the side of caution with quantity. Portion control is very important. You can have a great carbohydrate type, rich whole grain, but if you eat too much of it, it still has to break down to glucose. So your body still has to deal with that. So I often recommend start with actually quantity. For some people, you've got that wholemeal bread or like that bread you have at home, whatever it is, start with quantity. Reduce your carbohydrate. And one way you can do that is have more of vegetables. Have more of, other sources that are obviously healthy, but you're not getting carbs from them. So reduce your quantity. Once you get quantity right, then start looking at the quality. What is the quality of, carbs that you're eating? Okay. So the principle of healthy eating in terms of glucose management is really eating foods that are rich in nutrients, which we've talked about, as I mentioned. Blueberry, for example, is packed full of nutrients, but it's low in carbs. So you can have, foods like that as part of your diet, and especially for those who are really wanting to manage their blood glucose levels. In conclusion, so diabetes, we know, is a debilitating condition. It's a nasty condition if it's not well controlled. It's not a death sentence. I have to say this. It is not a death sentence because there is so much that can be done, but where people don't think about it or do anything about it, it can cause, as we mentioned, foot amputations, blindness, kidney damage, all sorts of things. But we've talked about the fact that it can be reversed. So for those who really want to work on it, it can be. Now, if you've had diabetes for a very, very long time, as we mentioned, where the pancreas may have been damaged, diabetes may not be reversed in terms from the medical point of view, obviously. There are many people here who have faith, and this got nothing to do with our faith. If you have faith, absolutely do have that faith, keep that faith. God can heal. I will say that very clearly. In terms of the medical side, for some people, they may have had diabetes for a very long time. What I would say is make sure it's well managed. Make sure you're going for your yearly checks with your GP, or for some people, a 6 monthly checks. Some GPs don't have good recall system where they can automatically say, right, you're due for a blood test. So you keep an eye, because ultimately it's your health. You are the CEO of your health. So it is your responsibility to seek help. And that's why we're putting this program together, to bring awareness, to empower people to get out there, get help, get, your healthcare professionals, bother them, let them know you're one person that takes your health seriously. And of course, we know poor diabetes management can cause avoidable complications. And final word, it's not easy. And I say it with hands on my heart. I know it can be difficult. And there will be times when you fall off that wagon. Do get back on there. It is not easy, but it is doable. It is doable. And on that last one, I had a patient of mine. I love telling this story because it brings me hope as well. He had diabetes for a very, very long time. He was put on all sorts of medications by his GP. He'd come because the diabetes was now more complex, GP couldn't manage, so GP referred him to our service. So I was talking to this man, and GP basically referred him for insulin start, and that was what he came for. And I just remember this man sharing his story with me. His wife had was unwell, so he was the main carer for his wife. He was stressed out. He had a job that he was trying to keep. And he just felt really down. And he said to me, I don't want to go into insulin though. Is there anything else I can do? So I said to him, there are things you can do, but you have to work with me on this. And we have to have a clear goal, not more than 3 months. If you're going to make the changes within 3 months and we see a change, then you may not need insulin, not because I don't want you to have it, or it's just because your blood works would tell me that you no longer need insulin. Off he went. I gave him some information. I gave him the principles as we've talked about today, really looking at foods that are low in carbohydrates, high in nutrients for him. So as I said, this is very specific to him because he didn't want insulin. And I said, obviously, if you don't want insulin, you need to take food that is not going to require insulin response. So off he went, whatever he did, came back to me 6 weeks later. His glucose has dropped dramatically. In fact, the medicine that the GP recommended, we could no longer, obviously, because he had improved so much, so he now had to cut back on his existing medications. And he felt he had so much energy. And he said to me, you know what? He said, I'm so happy you actually believed in me. I'm happy that you weren't a professional that just said that this is what you're referred for, that's what you're going to have. And ultimately, he was proud of himself because he had gone away, put into practice what we discussed, and he saw a positive response. I'm leaving that story with you today. I'm hoping that everyone can obviously go away. As we mentioned, the transformation comes from applying the knowledge that you have got today. Thank you so much for listening, and we'll open the floor for questions. Thank you.
Thank you so much, Norma. Thank you so much. What a word of knowledge. Can you hear me? Am I loud enough?
Yeah, we can hear you loud and clear.
All right. But no, what a word of knowledge, enough with some people, too much to take in from today's session. I believe we've all sat here for nearly 2 hours now, all throughout the presentation, to hear one good thing, to get one idea, or to get information that could help to make a difference in our life and those around us, our family members and our friends. Perhaps this information that you've collected today would improve your health. It would improve our health, and that's my hope, and that's my belief, and that's the very reason we initiated this platform, this meeting, to bring this awareness of diabetes within our community, within our genetic. Like I said previously, you cannot change your history, family history, but you have a choice to change your lifestyle. And that choice actually comes, from you. Of course, I do understand that sometimes, is a challenge, but we got to choose from what is already been said, to eat carefully, to exercise more, like most of us, or like most of, I know it's very hard, but it takes a real, strength, motivation, and courage, to adapt this discipline into your life, And my word of encouragement today, is that I haven't glorified diabetes. No, the talking is not about glorifying. It's about awareness that will make this difference, like I said. And I hope you've picked something today to take away with you, that will make a difference in your life and that around you. So thank you, Norma, once again for sharing that information. And in concluding, we have questions as well, which I would bring across quickly. Within 10 minutes, I think we still have about 10 minutes, just to, answer some few questions. And, like we've earlier said, if you want a one-to-one support or coaching in this area, contact us. And I believe I've, shared our details already, previously. I think I've been sharing our details. You get in touch with us. And for upcoming events and conferences, you can get such information online. And at the same time, you can also send an email, with your details, and I'll get back to you. Email preferably, or telephone number. Then I'll continuously update you on upcoming conferences. And we hope to do this soonest again. So I would share, the date across. And so without wasting many of our, wasting our time, I believe, Norma, you've already answered most of the questions. For those of us who are from a Black community and the ethnical background, some of the diets which you've mentioned previously might not be convenient for them to get, And so just in addition to my experience, really, and the reason I shared my story, and my experience actually impacted on how much I helped to reduce, my blood glucose level to the point of to become pre-diabetes. In the sense, it reduced to about 44 millimole from 69. This is a result of choosing alternative diet. Like Norma mentioned, instead of, eating too many of eba and pounded yam, reduce the quantity, yes, like she said, then go for alternative. I chose to choose, what's it called? almond flour to make a pounded yam, flaxseed. We all have that in Lidl, you know. Sorry, I'm promoting. They haven't paid me to advertise, but we have it in most of our shops, you know, where you get some flaxseed alternative to make pounded yam, which I use for my soup. I eat plenty of fish as well. Sometimes okra is good, lots of vegetable, plenty of water is very important as well. So I think that answers questions to those who live outside the United Kingdom. You know, you can still eat your eba, but eat in smaller quantity. You can eat what's it called, plantain flour alternative. Those are all some of recommended diet that did help. And most often shake your body, as they would say, shake body. So shake your body in terms of exercise, that would really help. And so that answered the question to say what are the substitutes. And another question that was asked, I don't know, this is not because I haven't tried this. He said, kindly tell us if water drained from slide okra soak overnight would help manage diabetes and blood sugar. I don't know. I
Yeah.
haven't tried it. I
Yeah.
don't know.
Can I just add on that? So there are lots of, you know, anecdotal advice out there in terms of they've not been studied, you know. So if I put my professional hat on, I would say I don't quite know because I don't have any research on that. But what I would say is, if you want to know if, for example, anything is good for you, there are blood glucose meters out there, okay? Now, as long as it's nothing detrimental to your health, for example, okra obviously is, you know, it's a vegetable, water is good for you. So there's nothing detrimental in that combination. If you want to know, if you drink it, for example, check your blood sugar. Is it, you know, is your sugars come down? The reason I tell you this is because I had a patient once that he swore by bay leaf, boiled bay leaf. He swore, was like, I'm telling you, nurse, this helps me. So I said, no problem. If it helps you, then obviously we'll see. And just as he said, his HbA1c dropped significantly. We had to reduce his insulin dose. So I took it upon myself to go and read up about bay leaf and boiled bay leaf. I actually found that they're beginning to research more, and they found that actually it helps with glucose levels. But and also cinnamon, we know that those are some herbs that has been shown to reduce glucose levels as well. What I tend to say in this kind of setting is, whatever advice I give, because I'm not your healthcare professional, it's really important you speak to your healthcare professional because they have your history, because there's some herbs you have to be thinking about in terms of your kidney health as well. So don't just take anything that's been recommended. Read about it, because for some people, it might be good for somebody else, but for another person who might have a kidney, you know, impairment, it might not be good for them. So just you know, should I say, just a warning, a word of wisdom there. Be careful with any like herbal stuff. Read up about it. And we know that there's so many herbs out there that are actually quite useful. I mean, things like turmeric, even ginger, we didn't talk a lot about that. Again, today, as I said, it's just about really generic information gathering, but herbs like ginger, turmeric have been shown actually to improve glucose levels. How it does in details, I'm not entirely sure, but we know that ginger, for example, is an anti-inflammatory vegetable. So, and we know that diabetes is an inflammatory condition. So anti-inflammatory, it will make sense that there will be impact in some way. So hopefully I've answered that question. I think there are a few more questions. Did you want me to just go through them quickly as well?
Yes, go quickly.
Yeah, because of time. So there was one about, if the weight loss is due to diabetes, does it count towards the benefit of weight loss? Fantastic question. I would say no. The reason being that in a state where the body is breaking down glucose, there's a lot of inflammation going on. That is not the normal way your body should utilize glucose, in sense of your sugars are actually still high at that point. So although you're losing weight, your sugars are high. What did we say? When the sugars are high, it's damaging the eyes, because of the sensitive vessels in the eyes. It's damaging the kidneys, again, very sensitive vessels in the kidneys. It's damaging the nerves. It's impacting on the heart. So weight loss due to diabetes is never a good kind of weight loss we would recommend. So it would not count towards that benefit. However, if you're losing weight because it's intentional and your sugars are well controlled, absolutely. Somebody also asked if I give an example of enzymes. There are enzymes like this. I think there's one called protease. That's one that breaks down protein in our bodies. So it's really because a lot of the, as I mentioned, the whole grain foods, the healthy foods, and non-processed food generally have nutrients that promote this enzyme, production, and promote the right hormones, promote good gut health as well. So if you're eating the right stuff, you'll find that your body will be given that opportunity to make the right stuff as well, if that makes sense, and to for general health and well-being as well. So thank you. I think that's probably all the questions we have. I don't know if anyone else has any question. I think there's a hand raised up. Yeah, I just let you.
Yeah, you can attend to that.
Okay. Yeah, please do unmute Pastor Carla, I think, is it?
Yeah, it's me. Can you hear me?
Yeah, we can hear you loud and clear.
Okay, first of all, thank you very much for the presentation. I think it's extremely helpful. And I think a lot more people need to be exposed to this information. I have 3 questions. One is just a throwaway question, which is, what does trans fat?
Hard on to what Pastor Kola.
Okay, so you will find that actually being a man increases your risk of diabetes. So men actually have a higher risk of diabetes than women. So just something to mention there. Also, in terms of, yes, women, I guess being the one who cook in the house is great to come, but absolutely, having the men here is important. Also, I think you asked about trans fat. Trans fat are basically unhealthy type of fat that comes from over processed oil. So you find that a lot of this fast food, if you think they change the oil every time they fry you chips, that's a big lie. They don't do that. They use the same oil over and over in frying the chips. So at some point, that whole process changed the structure of the oil. And that's what actually creates trans fat. So fast food, you find that a lot of fast food, even biscuits as well, contain trans fat. So you will find that if the food is whole, you've made it yourself, it's very unlikely you get trans fattening compared to processed and fast foods. Yeah, so over to you.
I think I didn't make that clear. I have an idea what trans fats are, bad fats, but what does the word trans mean? Is it transformational fat, transgender fat,
no, nothing.
Transphobic fat?
No, trans has nothing to do with sexuality at all. It's just the name. So a bit like when you have saturated fat, monounsaturated fat, polyunsaturated fat, and trans fat. So it's a type of fat that has been deemed as unhealthy. Yeah.
So trans is the short word for a longer word.
Oh no, it's just the name, trans fat. Yeah.
Okay, that's all right.
All right, Norma, are you done now?
Yes.
Yeah, just to answer the other question, about the emotional, consequence, that affects your meeting up to the target of maintaining, your zeal to carry on, pursuing a healthy lifestyle, based on experience and my history as well, is difficult. I wouldn't say it's not something easy, and it's just, that's the importance of constantly hearing. He said, faith comes by hearing and hearing by the word of God. But I will paraphrase that. Your faith will build on, your motivation will build on as you continuously talk about it, talk to people who are positive about it to motivate you alongside. So I remember most often when I'm falling behind, I will usually just call my sister or a few friends, and constantly what my sister will ask was, what's your reason behind what you're doing? What's your target? What's your goal? My goal is to have it reverse. My goal is to live in good health. So then when I go back to my goals again, so it allows me to get back on board, which most often I've missed it several times, whereby I go, eat the bad things I shouldn't eat. But that's not the end of the world. I wouldn't start beating myself about it or start, getting so anxious and angry. No, I've missed it. It's okay. Then next day I go back on track again, not to encourage, those of us who are trying to, maintain a healthy lifestyle is a discipline, yeah? And every discipline comes with you're torturing yourself in a way, something like you're denying yourself for some pleasures. And as you're doing it, you get used to it. And because there's that hope that there's a good outcome out of, what you're putting yourself through. So as a word of advice and encouragement for today's session, and something to take away, because that is our hope here. That is not just another casual meeting where you're just coming to gather facts and information, but it is a meeting where you can take something to make a difference, in your situation. So my prayer today, and I believe and I hope that you've been able to pick something, to take away with you that will make that difference, to improve. It is a word of hope. Our message today is a message of hope. Like I earlier said, our group is to bring hope into whatever situation you're in. And that's exactly what our Christ did. He was always bringing hope. And so I believe you receive hope today. Diabetes is not a death sentence, but when you apply the knowledge which you got today and from other people, it will make a difference, it will make a change in your life. So I will conclude. Think about yourself and think about your generation as well, your children, your sisters, your siblings, those people, looking up to you. What difference are you going to make in their life and in your life as well? So think about that and apply the wisdom which you've gathered from our today's session.